everyone. We want to welcome you to ALS Canada's 2025 webinar series. Today, our focus is on voice preservation. We are joined by two wonderful presenters who have presented to our community before, Avner Zeifman and Melody Chow. Avner is the speech-language pathologist at the multidisciplinary ALS Clinic at Sunnybrook Health Sciences Centre. He has been with the clinic for the past 5 years and has previously held a dual role with the Assistive Technology Clinic, where he prescribed high-tech communication devices to adults across Ontario. As the SLP in the ALS Clinic, Avner supports patients in the areas of speech, communication, and swallowing. One of his favorite topics to discuss with pals is the rapidly evolving world of voice banking. And we have Melody, who is the Communicative Disorders Assistant with the Assistive Technology Clinic. For the past 6 years, Melody has been programming communication softwares and training patients on how to use their devices. Melody also sits on the Centralized Equipment Pool Evaluation Group for new technologies that are being considered for the Ontario government-funded equipment pool. So please feel free to put all of your questions in the chat box, and we will be sure to answer all questions at the very end. So to get things started, I would like to hand it over to Avner and Melody.
Thanks so much, Emily, and thank you everyone for coming. We'll get started with the webinar today. Before I do, just want to again say thank you to Emily and ALS Canada for hosting us with this webinar. Thank you to everyone who's attending, to Melody for presenting with me, and to all of my SLP and AAC colleagues and everyone in the field who's really helped us learn about voice preservation. And really a lot of patients who I learned from. We don't have any disclosures for today. This is just something that we like to talk about. The topic material can be a bit heavy at times, just in terms of, ALS in general and changes that might happen with your speech or voice. So just wanted to note, if you do feel a little bit overwhelmed with the topic material, feel free to step out. We actually can't see anybody on the call right now, but the webinar will be recorded. So if you do need to miss a little bit, you can always come back to it later. The goal of today was to kind of come up with a really broad overview or basic kind of introduction to voice preservation. At the same time, we also tried to be as comprehensive as we could and cover everything about the topic at an introductory level. So on the one hand, if you're new to this, there's going to be a lot of information. It might be a bit overwhelming. On the other hand, if we've talked about this before, if you've heard about it, it might be a bit repetitive. So I do apologize if we're going too fast or too slow. As Emily said, we're taking questions, so just put in your chat and we will definitely save some time at the end to address any questions. So the topic is voice preservation. We sometimes refer to this as voice banking, but voice banking is actually just one of the different strategies of voice preservation. We're going to be talking about voice banking, message banking, as well as voice cloning. So there's a lot of ground to cover today. Emily gave us a great introduction, but just to kind of review, I'm Avner. I'm the speech language pathologist at the ALS Clinic at Sunnybrook. And I help with anything related to speech, communication, and swallowing. And Melody is the Communicative Disorders Assistant at the Assistive Technology Clinic, which is an AAC clinic, which also does assist a lot with voice banking or voice preservation. I also wanted to mention we did give a webinar last year in August on communication in ALS. It was kind of an introduction to the different types of communication tools we might recommend. So if you didn't get a chance to see that, that is recorded and available on YouTube. So you can definitely don't leave today, but you can always go back to that if you're interested or you think that might be helpful to get some background. So we came up with some learning objectives today, and it's really basic and simple. We're going to answer the 5 W's of voice preservation. What is it? Who should consider doing voice preservation? Why do I need to do it? And the why is in brackets intentionally. It's not mandatory. We'll explain more. When should I do it? And where do I start? There's a lot of information about this, but the first step is getting started. So that's something we'll cover today. Um, Beyond that, we're also going to talk about what next. When you finish voice preservation, what do you do with the product or end result? I will explain more about that later. The best part, though, is that we're also going to answer the question, what does it sound like? Melody and I did some voice preservation of our own, and we have some samples we're going to demo for you at the very end. So if you are a bit tired of listening to me talk, please hang in there. It's going to be fun at the end, I promise. Okay, so what is voice preservation? Voice preservation entails several different methods of preserving an individual's unique voice characteristics. Um, this will become a little bit more clear as we talk, but the goal of voice preservation is for use with text to speech. And I'll explain what that is. In order to understand that, we kind of have to take a bit of a step forward. Um, Again, this is kind of something that we talked more in depth about during our last webinar, but basically with ALS, we do have different types of symptoms, but everyone with typical ALS might have some changes to their communication, their speech, and their voice. And usually, if you do experience those changes, they're quite mild at first and manageable. But over time, if we see further changes, we might get to the point where it's a bit hard for people to understand you. And at that stage, sometimes we'll recommend some tools to help with communication, not to necessarily replace your speech altogether, but just to have a different way to get your message across if you really need it. And the most simple form of that is a technology called text to speech. So text to speech is basically the technology that converts written text into a computer generated voice. We actually have, you probably use text to speech in your life if you ever use GPS and the GPS reads the directions out loud. If you're using like a home speaker, like a smart speaker, it's used in a lot of different ways. But for our purposes, we'll recommend an app that is designed for this purpose, where you can type out a message or select from a list of messages, and your phone will speak the message out loud. Now, every computer, phone, device, tablet, every device nowadays come equipped with what we might call generic text-to-speech voices. So these are robot or computerized voices that are quite human sounding. We'll show you what those sound like when we do the demo at the end. So there is a way to use text-to-speech on its own. Voice preservation is a way of personalizing that experience. And with the different strategies, we'll explain how. So the first strategy we're going to talk about is voice banking. And this is the more commonly thought of form of voice preservation. Voice banking is basically a method to create a synthetic version of your voice. So what you're going to do is go to a website that offers this service or some type of platform that offers this service. It does require you to make specific recordings that are variable as per the individual platform that you choose. But basically, the platform will give you sentences to record yourself saying out loud. And then when you complete those recordings, you get this synthetic version of your voice that you can then use with a text-to-speech app. So it's not your voice, it's a version of your voice that sounds like you. And you use it with text-to-speech to have your phone, let's say, speak out messages in this version of your voice. The nice thing about it is that you can use voice banking to speak out any novel message. So you're not restricted to whatever recordings that you made. The recordings are kind of nonsensical. They're meant to capture the sound files or sound like bits and pieces of the sound profile of your voice. And then the resulting synthetic version of your voice can be used to type out anything and something you've never said before using this version of your voice. The other nice thing about it is that it can be used offline. So the resulting product that you get is this essentially sound file that you download. and you don't need internet access to use it. Once it's downloaded, you can use it with a text-to-speech app like the one you just saw, without internet access. We'll talk a little bit about the various different options or various different voice banking platforms later. When I put the star next to specific recordings because a lot of the voice banking platforms actually also offer this version of what we might call voice design, where you use old recordings of your voice. But the traditional version is specific recordings, and the design or custom voice options are often a separate fee on the traditional voice banking platforms. The next voice preservation strategy is message banking. So message banking, it's a little bit less common or less frequently used, especially if you pursue voice banking. The reason being that most voice banking platforms have message banking embedded into their program. What message banking is a little bit more simple. It's recording specific messages that you would like to have preserved in your voice. So this can be greetings, this can be names of family members or loved ones. It could be a story, it could be anything. But it's not a synthetic version of your voice. It's an actual recording of you saying those messages. What's nice about it is that there's no minimum or maximum in terms of the amount of recordings you have to do. You could do as little or as many as you want. There's also no quality requirements. It doesn't matter what your speech sounds like. We'll see a little bit more later about what the quality might entail or the differences in quality, but anyone can do it at any time. It can also be used offline, similar to voice banking. You don't need internet access for it. The one downside of message banking, if you're only doing message banking and not voice banking or voice cloning, is that you cannot use it to speak out any novel message. So you really are restricted to whichever messages you recorded. Um, and so essentially, if you're on a text-to-speech app and you have a list of those messages that you recorded, you would click on the message, it would play that recording of your voice. If you wanted to type out something new, you can still do that. You would just have to use the generic or computer generated voice that comes with the app rather than your own voice or a version of your voice. What's also nice about it is that it's a great option for linguistically diverse people with ALS. And what I mean by that is a lot of communication apps or text-to-speech apps or softwares are unfortunately Anglo-centric. They're designed based off of English, the English language. There are varying amounts of languages that are supported on different apps, but definitely not all of the languages. And so sometimes we'll have some folks who speak a language that's not supported, and they might have a hard time using a version of their voice with a particular app. With message banking, you can speak any language and record yourself, and you can use those recordings on a text-to-speech app, which is nice. The other really nice thing about it, which we'll review later, is that it's completely free. You don't have to pay anything for message banking. There are other free options as well, which we'll get to. So finally, voice cloning is the newest iteration of voice preservation. It's the most advanced technology out there. What it is quite similar to voice banking, but essentially you're creating a high quality digital replica of your voice using artificial intelligence. The end result is quite, like I said, quite similar to voice banking, where you have this version of your voice that you can type out any new message and it'll speak in that version of your voice. The difference is that it's not made or created using specific recordings. It uses any recording of your voice. And that's a real benefit because you don't have to record something on the spot. If you have an old recording from the past of how you used to sound, even before you notice changes to your speech or voice, as it were, you can use those to create a voice clone. You can really use anything, and it uses artificial intelligence to create this clone of your voice. The quality is really good. Um, it's a really good option. There are a couple of considerations to make. So number one, it does require internet access. Um, and this is where it's a bit different than voice banking. With voice banking, as we said, it's this version of your voice that is essentially a sound file that you download and you can use offline. With voice cloning, you don't own a file. You upload your recording, the artificial intelligence server creates this clone of your voice, and then whenever you want to generate a new text or text to speech with for a given text, you have to send that text to the artificial intelligence server, and then you get the clone of your voice for that given text. So any new messages, you need internet access to be able to access the clone. It doesn't present a huge barrier for most folks nowadays because on all of our phones we have Wi-Fi, we have data. It's really, if you're hiking in the Himalayas, you might have a bit of a hard time. But um, if you don't use it, you can always also use the generic voices, or you can do voice banking and voice cloning. So there's a lot of different options. The other consideration that we have to be aware of is that is with regards to security with using artificial intelligence. Again, it's not this file that you own. It's it's your it's a connection to this artificial intelligence server. Your voice data is stored on the cloud. So there is an added security risk associated with that. There are a lot of safeguards in place. If you feel comfortable with technology and you're very careful with not sharing your passwords, the risk is considerably low, but it is something that we have to be aware of. But the really nice thing about it is the higher quality. So traditional voice banking options don't they do sound quite like you, but they don't really accommodate for emotion and inflection. They're a bit of flat tone. With voice cloning, you get emotion, inflection, pauses, a lot of the kind of natural, I guess, flavors of what a voice or sounds like. The other really nice thing about it is that it is fully funded for individuals with ALS. And we'll talk a little bit more about that in a little bit. So now that we've gone through the different voice preservation strategies, who should consider any of these? The answer to that is anyone who might be interested. There are options for everyone, right? You can do voice bank. Some people can do voice banking. Some people can do message banking, voice cloning. There are different considerations to make in terms of if you want to do it, which option works well for you. And so some of the considerations are what is your technology experience, like we talked about? What is your background? What type of devices do you have available to you that will dictate what type of platforms you have access to? What is your primary language? Again, so not all languages are supported in text-to-speech apps, and they're not all supported on voice preservation platforms, which we'll cover a little bit more later as well. Speech quality will also have an impact. So if you have an old recording, you can always use that for a custom voice with voice banking or voice cloning. But if you're making recordings on the spot, that will impact how good the quality is of the end result. And for some voice banking platforms, you unfortunately won't be able to make a banked voice or a synthetic voice if your speech is progressed to a certain extent. Um, so the best thing to do is to speak to your specialist. So whether it's myself at Sunnybrook or another speech pathologist, Melody, or someone at your local AAC clinic, if you're connected with one, we can kind of help guide you through that process and figure out which option works best for you. Um, the million-dollar question, why do I need to do it? And I do want to address this because there is sometimes that we have folks coming to us saying, I need to do voice banking, I need to do it. No, everyone's telling me I need to do it. Why do you need to do it? Well, really, you don't. It's not mandatory. Okay. it is a great thing to do, and I'll get to that in the next slide, but it's not mandatory. And if you don't do voice preservation, this does not preclude you from using any text-to-speech app or software, right? As we said, there are generic voices that come with every device nowadays, and there are lots of good options out there. So it's not something that you have to do. There also are options for everyone. So if you um, don't do it initially, or you're not interested in voice preservation initially, and then later you change your mind, there might still be options for you, even if there have been more changes to your speech. Um, the best thing to do again is to speak to your specialist, because voice preservation is very specific to the individual, what your goals are, what's your interests, what capacity do you have, what other things are going on in your life. Sometimes it does take a bit of time and effort and investment, and it's often not a priority, which is okay. There are ways we can make it as simple as possible for you, but we can help guide you through that process. Sometimes it does feel like a big decision, so we can kind of help guide you to determine whether this is something you truly want to do, or yeah, kind of reassure you that it's not necessary if you're really leaning against it. And finally, I just want to mention it's not necessarily a binary, a one-time decision. Voice preservation is a topic I talk with a lot of people over time. So we might talk about it initially, maybe one of the first times we meet, but we don't really start the process right away. And we kind of revisit it through several later clinic appointments. And that's okay because it is a big thing to consider. And there are different options if you do it earlier versus later. At the same time, um, we do think it's a great thing to do if you are interested. Voice preservation can be really meaningful. Why? Because your voice is unique. It's your identity. It's associated with your personality, your sense of self. Um, for folks who have changes to their speech and they don't sound the same, or they're using text to speech, it might be a bit hard to communicate or feel comfortable using different communication methods. And so voice preservation can really improve quality of life. We've definitely heard that from people. Can also help maintain a sense of meaning, normalcy, familiarity, and independence. Um, so it is a really great thing to do if it's something you want. It can really have a big impact. And not everyone does voice preservation. I would say more people don't than do. But usually when people do the process, they report that they're happy that they did it. We don't often, and I'm not sure if we ever have heard anyone say that they've done it and they regretted it. So when should you do it? Ideally, as early as possible. Again, if you're interested, it's gonna work better earlier if you haven't noticed speech changes. If you have had mild speech changes, if they're mild, you can still do it. And again, we can kind of guide you to figure out if it's still going to work well. Um, One thing that you can rely on is if your speech is significantly impacted, let's say you only get to the point where you're aware of voice preservation and you've had a lot of changes to your speech, there are still some options that you can do, like having someone donate a voice on your behalf. So some people have a brother or sister or family member that sounds like them, and that individual can bank their voice and donate it to you. And you can use that as a voice a synthetic version of your voice that sounds like you. Um, the other thing that we want to kind of consider is the quality of input is going to basically dictate the quality of your output. So with voice banking, as we said, it's not, unfortunately not going to be successful if you have severe speech changes. And most voice banking platforms will give you some feedback and tell you that they're not able to make a voice if your speech is severely impaired. again, we can always have someone donate a voice or we can look at other options. For message banking, it's a bit more subjective, right? Because anyone can do it. There's no quality restrictions. But if you have better speech quality, you're going to get a better recording. So it's just something to think about. With voice banking, we're going to have the same type of restriction as, sorry, with voice cloning, we're going to have the same type of restriction as voice banking. But we have that added benefit of using old recordings. So if your speech is significantly changed, you can use old recordings from the past before you had noticed changes to your speech. So where do you start? You can start on your own. There are we're going to list the different platforms and options for you. If you're not sure at all, it is best to talk to a specialist. Um, like we said, we can help kind of figure out if you're a good candidate for, let's say, voice banking or voice cloning. And we can also review the different options and see what works best for you. We can also help guide you with updated information about the different options. The technology is rapidly evolving and changing. So there's lots of new things changing all the time. It's helpful to talk to someone who is in the field and can guide you about what's the most updated information. The next step is to kind of choose which one option you prefer from the available options. And then once you choose an option, we have to choose which service you're using to do your banking, whether it's voice banking or message banking or voice cloning. Although voice cloning, we only do recommend one option, which we'll get to. Um, the first thing that you can do before any of this, if you and you watch today's webinar, at the end you go, hey, I really want to do this, but I don't know where to start and I can't talk to Avner that quickly. You can just make a recording of your voice. So just use your phone, use any recording device, just talk into it, have a conversation. We just want you on the recording and no background noise. But you can use that for voice cloning. If you don't know where to start, that's really a good way to kind of jump into it. Um, and with that, I'll pass it over to Melody.
Thank you, Avner. So just another quick review of what equipment you'll need to start recording. The most readily available to everyone is your smartphone or tablet because it does have a built-in microphone. If you do want to use a desktop computer or a laptop, we do recommend using it with a USB microphone headset. For voice banking and voice cloning, you will need access to the internet. But regardless of whichever voice preservation method you choose, just make sure you're in a quiet space when you're recording. There are a lot of voice banking options that are available. The ones we have listed here are the ones that we know will integrate well with this text-to-speech app or communication softwares. On this chart, we organize the services based on the least to most expensive. So starting with personal voice, this is a free option available to Apple devices, mainly for iPhone versions 12 and later. This can also be used with Live Speech, which is Apple's free text-to-speech feature, or you can use it with Speech Assistant AAC. Now, after I said that, please don't go and buy a new phone just for this purpose. There are still other free or cost-effective options. The next one we have on the chart is Model Talker, and just note that all of the pricing is listed in USD. For Model Talker, it's $100 one-time fee. Voice Keeper is $5 monthly. Speak Unique is around $400 to $686 a one-time fee as well. With Acapella, you can either pay a one-time fee of $999 or you can pay annually, which will be $99. And all voice banking options do include a free sample, so you can hear what your voice sounds like before you commit to purchasing it. Now, voice banking options do have different recording criteria. On this chart, we've organized the options based on time commitment from less to more. Voice Keeper is very quick. You just need to record 5 sentences, so it'll take just around 1 minute. With personal voice, you will need to record either fairly short phrases, so around 150 sentences, sorry, and that will take around 20 to 60 minutes. For the newer iOS version, iOS 26, you require a lot less sentences. I think the minimum right now is around 10. With a cappella, you will need to record 50 longer sentences, and that will also take around 20 to 60 minutes. With Speak Unique, you'll need a larger sample, so around 125 to 150 sentences, and that will take around 45 minutes or more. Lastly, Model Talker does require 300 sentences, and that will take 1 to 2 hours. So with the exception of Voice Keeper, all other voice banking options we've listed above do allow you to record in multiple sittings, so you don't need to worry about completing everything in one day. In terms of message banking, here are some options for those who already have Speech Assistant AAC downloaded on their devices. You can use their built-in message banking feature. Again, Speech Assistant AAC on iOS-based devices is a $30 one-time fee. For Android, it is free to download, but in order to use the message banking feature, you have to pay for the full version, which is around $10. On your Apple and Android phones and tablets, there are built-in voice recording apps you can use. If you want to store your messages online on a cloud-based kind of server, mymessagebanking.com is great. You will need access to the internet. It also transcribes your messages, which is amazing. If you want to work offline and you want to use a computer, you can download Bridging Voices voice recording software, which is very easy to use. On all of these, oh, sorry, I just kind of reviewed that most of these options are free, which again, with the exception of Speech Assistant. Lastly, for voice cloning. So like Avner said, there are many voice cloning services out there, but we only recommend 11 Labs because of funding, and also 11 Labs is the only one that integrates with text-to-speech softwares and our applications. And in order to qualify and have it fully funded through the IMPACT program, you will need to ask your doctor or speech-language pathologist to provide a letter to confirm your diagnosis. There are 2 different voices you can create through 11 Labs. One is the instant voice clone, and the second is the professional voice clone. What it differs is the amount of recordings you need, and quality. So for the instant voice cloning, you just need a minimum of 10 seconds of quality recording, and for the professional voice clone, you just need a minimum of 10 minutes. There is a character limit for each generated message, regardless of the type of voice you choose. But there is a lower limit for the professional voice clone. So just to keep that in mind. Okay, so the first 2 steps are really choosing which voice preservation technique to pursue and which platform to complete the process in. Compatibility really comes after these steps, and because the process is and can be quite overwhelming, we typically recommend completing the first 2 steps, and then we can revisit compatibility when you finish the whole process. In terms of message banking, it's compatible with everything. Voice banking, it really depends on the platform. It's compatible with most communication softwares. Voice cloning, which is still relatively new, there's a limited amount of apps or software options. But for personal devices, you can use it on Android and Apple devices. And of course, it's compatible with Speech Assistant AAC as well. For our pals who speak more than one language, depending on the voice banking service, your language may or may not be supported. So for voice banking a cappella, it supports up to 30 languages, or sorry, more than 30 languages. Voice Keeper, on the other hand, only supports English, Spanish, and Hebrew. Personal Voice only supports English and Mandarin. With message banking, very flexible. It's good with you can record your own voice in any language. The only limitation is with literacy. So if you have difficulties reading the text in your language, it might be a bit hard to use this option. Lastly, for voice cloning, there are 74 languages supported. And then you can also create your voice clone in English and in a different language. So you can create multiple voices as needed. You can also use one recording for the different languages as well. So let's say you only have recordings of your voice in English. You can use that English voice to create an English voice, of course, and Spanish or Portuguese voice as well. And now on to the most exciting part is the demonstrations. So to start off, I did wanted to show you a generic text-to-speech voice that is available on your devices. So this is how it sounds like.
Hello, Avna. Thank you for teaching us about voice preservation.
Is mine. Thanks for listening to me talk and for your amazing editing skills.
Sorry, I got caught off at the beginning. I'm going to play that again. 1 second.
Testing, testing, 1, 2, 3, pause. Hi, Melody. The pleasure is mine. Thanks for listening to me talk and for your amazing editing skills.
There are a lot of voices available kind of built into your devices, so and also different accents as well. And languages, sorry. Next, we'll show you our bank voices. Sorry. So this first voice I'll let you listen to is my personal voice. So this is the free option I created on my iPad. You can use that voice across all your Apple devices. So you can also use it on your phone.
Thanks everyone for joining us for the webinar today. I hope everyone is keeping warm and that you didn't get too much snow.
And then I'm going to show you my a cappella voice. This is with the newest version of a cappella. It's version 5. So the quality is a bit of a step above previous versions.
This was fun. I'm happy to be inside right now. Today is not the day I would want to be stuck outside in the snow and slush.
And the next voice I'll let you listen to is done through VoiceKeeper. So this is the one with the lowest time commitment. You just need to record 5 sentences and they can generate a voice. And this is how it sounds like.
Let's go outside. How about a treasure hunt? I love exploring new places.
That's a really good quality voice for just 5 recorded sentences, Melody.
Yeah, it is actually really good. Pretty good. All right, and I did want to just demonstrate an example of message banking as well. So like Avner said, you can record anything you like. You can record greetings, family names, and stories. I did have a client record themselves singing a lullaby before for their grandchildren as well. But this is my own message.
I know the process of selecting voice preservation is overwhelming, so take your time to review the options and discuss with your SLP or AAC clinics.
So remember, that's Melody's actual voice, right? That's an actual recording, which is really great. We're gonna show you voice cloning now. So Melody and I both created instant voice clones. So these are not professional voice clones; these are instant clones. I recorded myself for about 5-6 minutes. Melody, I think you did about a similar amount, right?
Yes.
So this is my voice clone with just 5 minutes of recording.
Thank you, Emily, for hosting the webinar. We had a great time, and we really appreciate everyone turning out.
And this is mine.
We hope everyone found this webinar helpful. We will now open the floor for questions.
And that's our demo. Hope everyone enjoyed, and happy to do more if anyone wants to hear us say anything. But we're ready for your questions if you have any.
Amazing. Thank you both, Avner and Melody, for not only the information, but then the demos too. I think that can really give more insight into the different types of voice preservation. So we do have a few questions that have come through. So to kick us off, one of the questions surrounding voice cloning, how much of a sample is required for voice cloning?
Yeah, so we can just go back a little bit here. It really, you don't need a lot. So if you're doing an instant voice clone, ideally it's at least 2 minutes, but they will work with 10 seconds. So if you have an old voicemail and it's just a couple of seconds, you can use that, and that's enough.
Great. You actually answered one of our other questions about, can previous videos be used for voice cloning?
Yes. I don't remember if we talked about that, but you can use videos. Coming back to Melody's slide about the type of equipment and criteria you need, it does have to just be your voice in the audio portion, and you can always edit other background noise out. 11 Labs also does have a volunteer program that they'll take your recordings and edit them for you. So that can be done through their website, which is really cool. And so, yeah, it does have to be just you on the recording, not much background noise. And you can upload the video directly to their website.
And I guess just to add on to Avner, it could be videos, it could be also voice clips from WhatsApp if you like to record through there. Like there has I'm sure a lot of platforms or space where you can find those recordings.
Great. Thank you. So along the same lines of, who owns all of the data, how secure is it, and what happens to the recordings and data once the individual passes away?
That's a really excellent question. We probably should have covered that, but thank you so much for asking that. Um, it is there is a feature for what they might call legacy um, on various different voice banking as well as voice cloning platforms. For message banking, you're doing it on your own device, so you kind of own it already. Um, Voice banking platforms, I'm not going to speak to what exactly they do because it is um, specific to each platform. You'll have to look up on their respective websites. I know some of them will delete your voice after a number of years, and some of them will also have in their settings a legacy feature where as long as you enable this, it will allow a family member or loved one to access the voice data if you're no longer able to access her after you've passed. For voice cloning, that's a bit of a trickier question, and I'll have to look into that for 11 Labs. But again, the voice data is within artificial intelligence. They do have some safeguards in place, so there is a watermark associated with your voice file for professional voice clones. Um, and they have API keys that are associated with your voice data that's unique to your voice. So there's some security involved. Um, Melody, I don't know if you recall anything about legacy specifically for 11 Labs, but I'm not sure if they have a feature for that. See my notes here.
That I'm not sure. I don't remember, but what I do remember is just turning off the API code.
Right. Okay. That might be it. So it's not a specific feature, but you can disable your API code when you've done or not using your voice anymore, and that will disable it from being accessible online.
Great. Thank you. For voice cloning, are you able to walk us through how on a typical day an individual would use this type of support?
Yeah. So that's a really good question. I guess it is a variable for person to person. So I'm just going to take the example of someone who has recently used or created a voice clone. Let's say they haven't experienced a significant amount of change to their speech, but they have had some mild changes, and there are specific situations where people have a bit of difficulty understanding them. So let's say this is at the drive-through at Tim Hortons. So what I would do is use your text-to-speech app if you're able to use a phone. I have Speech Assistant on my phone right here. So this is the text-to-speech app we often recommend. In the settings, it might be hard to show you on the screen, but they actually have settings specifically for setting up your 11 Labs voice within the app. It's once you get your API key from the website, you copy it onto the app, and then it basically enables the voice just like you would enable any other voice on your app. And that's what I did here. So I'm just using my Speech Assistant app. So coming back to our example, day to day, I'm going to Tim Hortons. I have to give my drink order through the drive-through, and I'm just going to type it out quickly, like sugar. And so I just typed out my message on the screen, and then I'm going to hit the speak button and make sure my volume's all the way up.
Double with cream and sugar.
Sorry, there's a bit of a lag there because of the Bluetooth speaker. Give me a second. Let me try that again.
I would like a double with cream and sugar.
So I just typed out, let's say, a random drink order, and then did it on my phone. And so essentially, when you're using a voice clone in day to day, it's not that different than how you might be using a banked voice or a synthetic voice that you did with voice banking. You just use it on your text-to-speech app in face-to-face conversations with, customer service at the drive-through.
Great, thank you. Another question. I noticed most of the software mentioned seems to be US based. Does this mean all the data is stored under US privacy laws and on US servers?
That's a really good question. I would imagine, I'm going to say I don't know because I want to be transparent. I don't know exactly the answer to that. I would imagine the answer to that is probably yes. So it is, if you're using a US-based service, it's going to be subject to US privacy laws, but also considering the fact that these are web-based programs. So there is some web-based compliance regulations, I'm sure, involved. As you would with any website like Amazon or whatever? That's a good question.
Thank you. How are banked questions and statements decided upon?
Banked questions in statements.
So how do
I'm not sure I
individuals
understand.
decide which questions or statements that they choose?
To make the recordings?
Yeah.
Okay. So when you're doing voice banking, okay, voice cloning is separate. For voice cloning, you can record whatever you want. There are different prompts you can use, and you can choose to read a story or have a conversation, but it's really whatever you want. For voice banking, you don't choose what you record. The platform, whether it's personal voice on your iPhone or Acapella or Model Talker or any of the platforms that we talked about, they will give you the sentences to record yourself saying. Um, some of them are in form of statements, some of them in form of questions. They might be, but you don't have to worry about that. They're going to tell you what to record, and the way they um, make your synthetic voice read questions is a bit beyond my knowledge, but it's not something that you prepare. You can do with message banking or custom messages on a voice banking platform, not to confuse everything, but you can do questions and you can choose what you want to add. But again, that would be message banking, and that would be um, a, a recording of you saying that question. And then when you use it with text to speech, it will be playing that exact recording. really be part of your banked or synthetic voice. So for recording for voice banking, um, you use the sentences that they give you. You don't have to choose what to input.
I guess also in terms of message banking, if I wonder if the question was also like, how do I know what messages we would want to record?
Yeah, we can answer that. You wanna
I
talk about that, Melody?
really ask that the question about. I think anything that's really meaningful to you, where you feel that those phrases need to capture your tone and your personality. So it could be a laughter, like it could be a joke, it could be stories as well, or any like memories you want to recall. Yeah, I hope that answers. Like, Abner, do you have anything to add?
Yeah, no, I would say exactly that. I would only caution to not do what I did, which is if you're doing voice banking and message banking, right? Remember, you don't have to do message banking if you do voice banking, but you have that option with most voice banking platforms where if you do voice banking, they have the option of these custom messages, which is basically message banking embedded into the program. I recorded myself saying some things that I think would capture me, like the way I say thanks or how are you? Um, it's gonna, when you play it out on your text to speech, you're typing out a message. If thanks is part of the sentence, it's gonna play that recording and then your your synthetic voice. So that can kind of throw it off a little bit if it's not a standalone thing. When I was preparing for this, I changed it to thank you, Emily, for hosting the webinar. But initially I had thanks, Emily. And because I did message banking for thanks, it sounded like this. Thanks, Emily, for hosting the webinar. It was a bit wonky. So it's just something to be aware of. But definitely follow what Melody said in terms of what types of messages you want to include. It's whatever's important to you. Greetings. We also do have some templates we can send you if you'd like to have a guide. Boston Children's Hospital has a really comprehensive guide with like tons of different messages you can choose from.
Great, thank you. Another question, does the sample recording need to be done all at once? If someone is starting to have problems speaking, it could be a little overwhelming to record 150 sentences all at once.
Yeah, I think Melody answered this before. So do you want to talk about that, Melody?
Yeah, so for all the different voice banking options, you can pause at any time. So of course, we don't recommend you doing all of it in one sitting, because that's one, overwhelming, and we want to be mindful of your voice as well. You want to make sure your voice is the best quality when you're doing these recordings.
Yeah, we also don't want you to strain your voice, so make sure you're well hydrated, using a quiet space, like Melody said, a microphone. Um, yeah, take breaks as needed.
Great, thank you. I have one final question that's come up. Have you guys heard of a non-invasive system that reads one's thoughts and speaks live?
I was waiting for this question to come up. It all comes back to brain-computer interfaces. They exist, and the question is, how well do they work? Um, are there not? You asked non-invasive, right? Yeah. So uh, the tricky part with brain-computer interfaces is it's been around for a while, but the newer technology, like the invasive ones, like the Elon Musk's Neuralink, are invasive, and all of the newer ones that are supposed to be very promising are still in either clinical trials or preclinical trials. We haven't heard of any of them being commercially available yet. And we don't have a good sense of how well it's going to work for everybody. For non-invasive ones, there are some kind of brain-computer interfaces that we've used in the past that did not work really well. So I mean, Melody might have more updated information about this, but as far as I know, we don't know of any non-invasive um, brain-computer interface type technologies that are similarly effective to other types of communication devices.
But to add on to Avner, the only, I guess, brain interface that I had a bit of experience with required a lot of training, very intensive training. Um, so yeah, that's kind of it. And everything else Avner said, there's nothing else for me to add.
Great. Thank you guys. So regarding 11 Labs, we've had quite a few questions about 11 Labs. You mentioned about needing a potential referral for the impact program. So would someone have to go through their doctor to be referred, or who would they
Yeah.
need to go through?
Yeah, so you don't need a referral. You just need a confirmation of your diagnosis. It's actually pretty simple to apply. Um, we were just talking about this before the webinar started, but once the recording is available, Emily's going to share that on YouTube, and we'll include links with directions for how to find all these websites and do these things. But briefly, for the Impact program, once you create an account, there's at the bottom left side of the screen where your name is, you click on that, click Apply for Impact Program, and then you just go through the steps there. Once you fill out all your information, the last step is to generate an email, and so it will auto-populate this email with information that will go to the 11 Labs team, and all you have to do on your end is get that letter of confirmation of your diagnosis and attach it to that email. Once you send it, you'll get another email back to you that says that you're approved. And when you log in again to your 11 Labs account, it will be upgraded to a pro account, so that's fully funded. When you're creating an account, don't put in your credit card information. Skip that step. You don't have to pay anything. You don't have to put in any credit card info.
Great, thank you. Just making sure of any final questions. No, I think you guys have provided such very helpful information. I know it's questions that come up quite often, not only for you guys, for us at ALS Canada as well. So we really appreciate both yourself, Avner, and Melody for sharing the information, answering all these questions that came up, and for coming back and doing this type of presentation, because we know it was really well received the last time you guys did that last year. And so thank you for coming back again. And to everybody that was able to attend today, thank you so much for your very active questions. It really helps us provide more information when people can watch this all back. And so this recording will be available within 2 to 3 business days on ALS Canada's YouTube channel, along with all of our other webinars that we have available. If there are any additional questions for either our ALS Canada or for our presenters, please feel free to reach out to communityservices@als.ca, and we'll be able to share additional resources along with the resources that Avner and Melody are going to share with us. So again, I want to thank you, Avner and Melody. Thank you everybody for joining the webinar today, and we hope you have a great rest of your day. Thank you, everyone.
Thanks,
Thank
Emily.
you.
Thanks, everyone, for coming.
Bye.
Bye-bye.